can do this, right?
No.
All right, good. All right, let's see. Let's look at the sinuses. A sinus is a cavity in the skull that moisturizes air. Okay. Now here we have the frontal sinus. This is the frontal sinus, and this is the frontal sinus. Okay.
Is it again?
All right, those are frontal sinuses. This is ethmoid sinus, and here we have the maxillary sinus, Those are three sinuses that will moisturize air that you inhale. Okay. All right, let's look at the nasal cavity. All right. The boundaries of the nasal cavity are the external nares. External nares are the nostrils right here. External nares, which is 400 here. Okay. External nares. The air enters the external nares and enters the vestibule. This is the space called the vestibule. And then it enters the nasal concha. There are three pairs of nasal concha. Nasal concha have two functions. Number one, they will filter the air. The nasal concha are covered by a mucous membrane, and the mucous membrane will secrete mucus that will entrap part of the debris that you inhale. Number two, they warm the air. The nasal concha sends the air into a spin or into a turbulence, and the spinning of the air warms the air. Those are the two functions of the nasal concha. In between the nasal concha, you have these grooves. These grooves here are called meatus. M-E-A-T-U-S-E-S. Meatus. Okay?
Does that have a number?
Yeah, I guess 406 and 409. Those would be the meatus, the grooves between the concha. At the back of the nasal concha would be the internal nares. All right, so the boundary of the nasal cavity will be between the external nares and the internal nares.
Can you point to the internal nares?
Right here, right here at the back.
Okay.
The back of the nasal concha, the internal nares. Okay. The nasal concha then leads to the nasal pharynx. The nasal pharynx is here. Okay. The nasal pharynx is found between the internal nares and the soft palate. That's the soft palate. Okay. In the nasal pharynx, there are two structures that you should know. Number one, you will have the pharyngeal tonsil on the back wall of the nasal pharynx. Okay, pharyngeal tonsil. Pharyngeal tonsil is also called the adenoid, right here. Adenoid, A-D-E-N-O-I-D. Also in the nasal pharynx, you'll have the opening to the eustachian tube. Eustachian tube is E-U-S-T-A-C-H-I-O-N. E-U-S-T-A-C-H-I-O-N.
Professor, can you point to it again?
This opening here. Okay. Another term for eustachian tube will be the pharyngotympanic tube. Pharyngotympanic tube. Let me write this down for you. Okay, pharyngotympanic. Or eustachian tube. Okay. All right, now the eustachian tube leads from the nasopharynx to the middle ear. And in infants and toddlers, that tube is very short. So whenever the infant or toddler gets a common cold, the common cold virus will move from the nasopharynx to the middle ear and will cause ear infection, and that ear infection is called otitis media. Otitis media. Okay? Inflammation of the middle ear. All right? Now, how does a 1-year-old who cannot speak yet tell you that he has an ear infection? Well, he pulls on his ear. Pulling on his ear gives him a little relief, okay? So that needs to be treated, okay? Don't treat that at home. Don't put sweet oil and, all sorts of things that I've heard parents do. Take him to see a pediatrician, because if that's untreated, that can lead to hearing loss. So you don't want your child eventually having to wear a hearing aid. Okay. All right. The nasopharynx then leads to the oropharynx. The oropharynx is the mouth. Okay. All right. So here's the oropharynx here. In the oropharynx, there are 2 other tonsils. You have the palatine tonsil here, which is the back wall of the mouth. And then there's another tonsil at the back of the tongue. But the tongue is removed here, so you don't see that. And that would be the lingual tonsil. Okay?
Where's the palatine tonsil?
Right here. The back wall of the oral cavity. Okay? What is a tonsil, Paul? What is a tonsil?
Sure.
What is a tonsil?
I'm not sure.
Well, we mentioned that before.
It's a growth at the back of the mouth.
It's a what?
A growth. That's
A growth. Oh, growth. Michael, what's a tonsil?
I'm not sure.
We talked about this. What is this?
Talked about it.
We didn't talk about tonsils? All right, tonsils are lymph nodes. Lymph nodes, okay? Lymph nodes are a major part of our immune system, okay?
What did you say the tonsil that's under the tongue or by the tongue is called?
It's that back of the tongue, lingual. Okay? Now here, this is the submandibular salivary gland, which is located in the floor of the mouth. Submandibular salivary gland. Okay? So you'll know what that is. All right. Leaving the oral pharynx, the boundary of the oral pharynx would be the soft palate and the base of the tongue. All right, we leave the oral pharynx and we enter the laryngopharynx. The laryngopharynx leads to both the esophagus, behind the trachea, and the larynx. This will be the esophagus, and this will be the larynx in this area here, okay? In the larynx, you will have the glottis. The glottis is the airway. This is the glottis here. Queenie, are you able to see me?
Yes.
Because you know I'm calling you.
Oh man.
Okay? Then on each side of the glottis, you will have the vocal cords. So 416 and 417 will be the vocal cords. When the vocal cords are stimulated by air, what do we call that?
Phonation.
Phonation is production of sound. Okay, good. All right. Now, remember I said that the trachea is protected by tracheal cartilages. The tracheal cartilages are C-rings, meaning that they have no cartilage in the back, just on the sides. So they look like this. They look like this. Okay? In the back, however, there's a muscle. And this muscle is called the trachealis.